This disease, unlike Ebola, that is, unlike malaria or typhoid, requires extensive, comprehensive personal protective equipment, or PPE, to be worn by anyone who's providing care. There have been over 250 healthcare workers infected and over 125 who have died. I think that the personal protective equipment could have been better. We didn't have any of these, I call them surgical gloves, that come up well above the wrist. Instead we had what are called exam gloves, which basically come up just to the wrist, and they're not a very strong material. The goggles that we had it steamed up, fogged up. You couldn't see very well out of them. And you start sweating profusely before you ever set foot into the unit where the patients are. But I walk very slowly, and I do everything very slowly when I was in the unit, and I'm always there with someone else. You don't have to be exhausted to make a small mistake when you're taking off your PPE. You wash your hands in bleach after every single step, every single piece of your PPE that you take off. So it takes a lot of time, but you got to take the risk as close to zero as possible. In the end, what matters is, what actually happens. It's not the intention, it's what happens. It's, do you get the surgical gloves? Do you get the ambulances? Do you get the petrol? Do you get someone to drive the blood samples to the lab? Does the lab have electricity, or is a generator out to run the tests? And it takes all those things to happen.